everyone, very warm welcome to the Canada News with your host Gurdwara. Today's top stories are NDP MP Gurdwara Singh alleged the Associate Minister Prabneet Sarkaria was confusing the people of the province. He said the minister had made a statement that Pfizer was not effective, which was totally wrong. That is why the federal government should close the border completely so that the vaccines remain safe and new variants don't come.
Speaker, when everyone should be doing everything they can to get vaccines to COVID-19 hotspots and to fight vaccine hesitancy, the Conservative government's confusing and mixed messages aren't helping anyone. On Thursday, the Conservative Associate Minister for Small Businesses confused Ontarians by suggesting that the Pfizer vaccine, the same vaccine that Ontario has received over 4.5 million doses of, is not as effective as it could be, despite the fact that the Conservative Associate Minister represents Brampton, a city that is one of the worst hit by the COVID-19 crisis in this entire country, and where folks know they're not receiving as many vaccines as they need to protect lives. Why is the Conservative Associate Minister going out of his way to confuse people about the effectiveness of this vaccine when communities like Brampton need it?
To reply, the government House Leader.
I don't think the minister is doing anything of the sort, Mr. Speaker. What the minister is highlighting, and the minister from Brampton is highlighting the fact that we remain very troubled by the inexcusable reluctance of the federal government to act on our borders, Mr. Speaker. We have highlighted a number of issues with borders. We have seen the variants of concern which continue to come through our borders. Even this past weekend, a significant more, Mr. Speaker. This is very troubling, and we need the federal government to live up to its responsibility to secure our international borders so that as we continue to hit hotspots like Brampton, which has seen a significant increase in the amount of vaccinations that it has been getting, Mr. Speaker, so that we can continue this good work, we need the federal government to simply step up and do what we have asked it to do what everybody is asking it to do. Close that border so that we can get these variants of concern under control. And I would ask the member opposite to join with us in this, Mr. Speaker. This is certainly not a partisan issue. We should all be concerned with what we're seeing at our international borders, and I hope that he will assist us.
The supplementary question.
Thank you, Speaker. Back to the Premier. Ontarians are smart. They listen to the science. They respect the expert doctors who have told them to take any vaccine available to them. And they know that after this Premier and this Minister for Small Businesses failed to bring in enough paid sick days, failed to protect lives and protect small businesses, that the number one thing that they can do for themselves and their families to stay safe is to get vaccinated.
NDP National Leader Jagmeet Singh said that even today the workers were getting sick due to not getting paid sick leave properly. But the Prime Minister Ford and Prime Minister Justin Trudeau have not been loggerheads over the issue. Singh said it was important at this time to take the workers by the arm to protect Canadians.
We're seeing the Premier of Ontario, Doug Ford, obsessed with fighting with the federal government, and then Justin Trudeau, the Prime Minister, fighting back, when really the focus has to be on getting people the help they need. Of course, we need to be better at ensuring that the borders are secure and that no new variants are entering the country, but we know the most important thing right now, the most important thing, based on all the expert evidence, is that people are getting sick at work and that paid sick leave would save lives. So we continue to put pressure on the federal government, Justin Trudeau, to improve the paid sick leave program. It needs to be better, more flexible, cover entire salary for a worker, the day's work, make sure that it is flexible and easy to access. These things would save lives. That's what we want to see. And we want to know that every step possible, every resource possible is being used to get people vaccinated. We know people need to get vaccinated and people need to be safe so they don't go into work sick. These are two concrete things we can do right now. That's where the focus should be. So I can say very clearly that the people who are not wearing masks, who aren't following public health public health expert advice, are putting other people in danger. They're not thinking about their neighbors, the people around them, and they are risking an increased spread of COVID-19, which is going to make things worse. And so I would say to folks, we are in this pandemic where we have to take care of one another. We've got to look out for one another. And it is important to follow public health guidelines so that we can reduce the spread and so we can keep each other safe. And I would encourage everyone to do that. And those who aren't doing it, I would remind you, you are putting your friends, your neighbors, the people in your community is at risk, and it's the wrong thing to do. And I've opposed the expansion. So Trans Mountain was an expansion, and really I'm focused on what we can do to create jobs. And we know that right now resource sector workers in Alberta are hard hit, and so we're proposing solutions to get people jobs right now, not in a distant future, not in a precarious and unpredictable way, but something concrete right now. So we've talked about putting money towards remediating abandoned oil wells as a way to create jobs right now for those workers. There is an urgency right now. People don't have jobs, and projects that are counting on future potential of expansion and future potential for sales without having a market that.
Responding to questions about Pfizer or other vaccines, the Canadian Health Minister said that every vaccine is approved by the Health Canada and it is recognized only after the trial as run, which said the different vaccines are being given to provinces and territories according to different circumstances. According to the Health Minister, rapid testing is being used in business establishments.
Well, first of all, let me be really clear with Canadians that every vaccine that's in use right now has been approved by Health Canada as safe and effective. And of course, NACI's guidance is for provinces, territories, and immunizers so that they can make the best decisions about which product to use for which kinds of people. And we've seen them make advice around age categories, for example, or certain kinds of approaches, for example. And but I will just say that the best and safest shot is the first one you're offered. And healthcare professionals are the best people to talk to if you have any questions about vaccination for your own health. Well, I think, our approach has been to have a diverse portfolio of vaccines because there are a variety of different kinds of needs in the country, including geographical barriers, including different kinds of populations. And so our portfolio, as you know, has been diverse, built on that understanding that there are different vaccines that are right for different populations, and there are different realities in terms of how these vaccines are delivered. So right now we're working with the manufacturers of the approved vaccines, and in fact, we also have vaccines, Novavax, for example, Medicago, that have submitted to Health Canada for approval as they proceed down their clinical path. And we'll continue to assess the safety of all of these vaccines. This is an ongoing process. It's not a one-time and we're done. Health Canada continues to evolve their analysis based on the data that's accumulating in Canada, the data that's accumulating internationally, and we wouldn't hesitate to cease or pause the use of a product if it was shown to not have value, safety, or effectiveness. And in fact, a number of larger businesses have been using rapid testing as a layer of protection. Let's remember, there is clearly no silver bullet in the pandemic, and all along we've been searching for silver bullets to protect people, to save lives, to end the pandemic. But each tool is really useful, and rapid testing can really highlight for a corporation, and it has, by the way, that there are cases, very asymptomatic cases in the workplace, which then allows for the company to take action very quickly.
Brampton Mayor Patrick Brown also called for a complete shutdown of air travelling, saying Brampton City Council has been demanding it since day one. Because of this, we can prevent new variants from coming to our country. Mayor Brown said, of course, Peel is hotspot, but with the increase in vaccination, things will get better.
Well, Brampton City Council has been pushing for this since March of 2020 when the pandemic started. We suggested that all air traffic for leisure purposes be canceled until we get through this pandemic. And if you look at the variants that have got into the country because of air travel, it's wreaked havoc in our communities. If you look at the cost of some of these variants and the ravage they did earlier in the year in long-term care settings, right now the concern over the new Indian variant that has entered the country, I really believe that we should listen to the science, listen to the data. And I know our medical officer of health in Peel Region, Dr. Lowe, has said he's concerned about the loose restrictions at the airport. And for me, it doesn't matter if it's a Liberal idea, a Conservative idea, an NDP idea. I criticized the Ford government when it came to closing outdoor amenities, but in terms of their request to have greater restrictions at the airport, that's based on science, and I support it. Book those flights on a non-direct basis. That's what happened when they canceled flights from the UK. Every travel company simply rerouted those flights. And so there is leisure travel happening. And for me, it's frustrating to see this debate between the province and the federal government trying to make this about medical supplies or international students. That it has nothing to do with that. Of course, we want medical supplies coming in through the air. What this is about is leisure travel. Shut down leisure travel. We can't afford more variants entering the country. Our hospital system's already at capacity. And at least during the stay-at-home order, I don't know why we permit leisure travel. For me, it doesn't make sense. They're ahead. The focus on hotspots is paying dividends. Right now, we now have undertaken a really robust vaccination campaign. Our medical officer of health believes that we could be in a position where by early June we'll have vaccinated 70% of the population. Right now, we are currently vaccinating vulnerable essential workers, and I believe vaccinations paved the way for getting back to normal. And because we're now vaccinating our most vulnerable environments, I really believe there are better days ahead.
Dr. Yeffy, Associate Medical Officer, Ontario, reports on the weak COVID-19 outbreaks in Ontario. He said 11,000 cases were reported in Ontario during Thursday's update, and during today's update, 2,716 cases were reported. He said the average of these 7 days were 3,017, and during today's update, 2,716 cases were reported. He said the average of these 7 days was 3,017.
I want to start first by acknowledging that this is National Nurses Week. And our nurses have been working tirelessly to keep us healthy and safe. Thank you to all the nurses for your selfless dedication and the tremendous care that you have shown and you will continue to show to the people of Ontario. Thank you very much. Since the last update we provided on Thursday, Ontario has reported an additional 11,962 cases of COVID-19. That's 3,166 cases on Friday, 2,864 cases on Saturday, 3,216 cases on Sunday, and today 2,716. Our 7-day average of daily cases is 3,017, and that is down from a week ago where we had 3,577, and even further down from 2 weeks ago where we had an average of 3,917 cases. Sadly, we are reporting an additional 114 deaths since Thursday's update. This includes 47 COVID-related deaths yesterday, which is unfortunately the highest daily count we've had since mid-February. This brings our 7-day average for deaths to 30, which is up from 26 last Monday. As always, we extend our deepest sympathies to the families, friends, and caregivers of those who have passed away from COVID-19 and to everyone mourning the death of a loved one. We continue to see some improvement as hospitalizations and ICU admissions do continue to slowly decline. However, the numbers are still too high. Today, there are 1,632 people in hospital with COVID-19, and of them, 828 are in the intensive care unit. Our testing volumes were very low yesterday, with only 27,175 tests processed, with a positivity rate of 9.1%. The current 7-day average for percent positivity is 7.5%.
Toronto Mayor John Tory briefed the City of Toronto on the COVID-19 vaccine process. Team Toronto has so far vaccinated 1.45 million Torontarians. He said more than 50% of Toronto residents have been vaccinated with the COVID-19 vaccine. He also said that the highest number of registration for the vaccine was made this weekend.
And we should say it every day, but this week in particular, we are thanking and honoring registered nurses, nurse practitioners, registered practical nurses, nursing students, working in all settings, including public health nurses. The pandemic has shown us the courage and the commitment that nurses provide every day, and it's highlighted the crucial roles that nurses undertake. Nurses have been on the front lines of this pandemic for more than a year now, and they've been a source of inspiration and resilience and hope. And we want to acknowledge as well the effort and the energy and the courage that it is required for them to do their jobs, I'm sure, like a lot of people, but in particular they must be fatigued by now, but we encourage them and love them and want them to carry on doing the excellent job that they can do. And I think one of the best ways in which we can help nurses in their efforts against the fight against COVID-19 is to continue to follow public health measures and to get vaccinated as soon as we become eligible. Speaking of vaccinations, Team Toronto has now distributed more than 1,445,809 doses of COVID-19 vaccine. More than 50% of eligible Toronto residents are now vaccinated. We passed that threshold this weekend, as noted. And as Chief Pegg will detail shortly, this week will be our biggest and busiest dose administration week, with more than 98,000 appointments in our city-run clinics alone. Thank you to all of our hospital and healthcare partners who are working with the city and with community organizations to get Toronto residents vaccinated. This work over the last several weeks has included a focus on our hottest hotspot postal codes, and it is making a major difference in our fight against COVID-19. To cite two examples from the numbers as to the progress we are making and the momentum that we've developed, first, in the 13 hottest hotspot postal codes where there were very low rates of vaccination, we have gone from under 15% vaccinated as of April the 5th to more than 40% as of May the 2nd. And across the city, while it took us from late last December, when the first doses arrived, to May the 1st to get to 40% of eligible residents vaccinated, we have in the past week gone from 40 to 50% plus, with the momentum and capacity to carry us, supply permitting, to beyond 65% in the next 21 days.
Dr. Alan Dibla, Medical Officer, Toronto, reports on COVID-19 outbreaks in the city of Toronto. He said 2,529 new cases were reported in the city of Toronto. 1,095 patients are admitted in the hospitals and 2,069 critically ill are admitted in the ICU, and 37 patients have died in last 3 days.
Today, I'm reporting 2,529 new cases of COVID-19. I remind you that when we report on Mondays, the case count figures include all cases since the report on Friday. So this averages to 843 cases daily. 1,095 people are in the hospital. 269 people are in the ICU. And I'm saddened to report 37 lives lost to COVID-19 in the last 3 days. As of yesterday, over 1.4 million doses of vaccine have been administered in Toronto. As you heard, we are on track to meet and even exceed our next goal of first dose vaccinations for 65% of Torontonians 18 and older by the end of May. As the vaccination efforts move forward, we are positioning ourselves to enjoy, in time, increasing flexibility and normalcy in daily life. We are seeing this in places like the United Kingdom, which is ahead of us in the delivery of vaccines and has lived within the limits of a strict lockdown for many months and is now transitioning out of it on a phased basis. We too are moving in the right direction, incrementally. These are the facts that define the state of COVID-19 for us in Toronto. Our 7-day moving average for new COVID-19 cases is 963. To describe the situation another way, the latest rate is 262 cases per 100,000 people per week. The good news is that this is the third week in a row with a decline in cases per 100,000 people, but it is still well above the peak from Wave 2, when it was 244 cases per 100,000 people per week.
British Columbia Medical Officer Dr. Bonnie Harry sheds light on the condition of COVID-19 in British Columbia so far. He said 519 cases were reported in the province and Saturday 605 and 558 new cases were reported in the last 24 hours.
Today, we're reporting on 3 periods over the past weekend. From Friday to Saturday, we had 596 new cases of COVID-19 diagnosed in British Columbia. Saturday to Sunday, 605 new cases. And in the last 24 hours, 558 new cases of COVID-19 diagnosed. That brings a total of 1,759 people diagnosed with COVID-19 over the weekend, and our total in British Columbia to 136,100 people. Of the new cases, 325 are people who live in the Vancouver Coastal Health Region, 1,201 are people living in the Fraser Health Region, 50 are people living on Vancouver Island Health, 131 people are in Interior Health, and 52 are people in the Northern Health Unit. We now currently have 6,140 active cases around the province, of whom 415 are in hospital. 150 people in ICU or critical care, and 128,139 people have recovered from COVID-19 from their acute infection. We have no new healthcare outbreaks to report today. We do have one outbreak declared at the Sunrise Poultry plant in Fraser Health. And outbreaks have been declared over at the Surrey Memorial Hospital and Dufferin Care Centre. This leaves us with 3 active outbreaks in long-term care, assisted living or independent living, and 2 in acute care facilities. Sadly, over this past weekend, we've lost another 20 people in British Columbia to COVID-19, bringing the total number of people who've died in our province to 1,622. As always, our condolences and our thoughts and prayers are with the people who have lost a loved one, with their care providers, and with their whole communities. We know how challenging it is to have to mourn during this difficult time. I did want to give a breakdown of the age ranges of people who've passed away this weekend. Sadly, it is again overrepresented by seniors and elders in our community, with 15 of the 20 people who died this past weekend being over the age of 70.
Another unfortunate piece of news has come out from Canada, where a young man from Majke village in Mudda district died of a heart attack in Oxford. According to reports, the young man came from work at around 2 a.m. and had a heart attack in bathroom while taking a bath. The young man had come from India to study in Canada 2 years ago in the hope of a better future. News of deaths of international students in coming days has caused a wave of mourning and concern in the community. Sandeep's last rites will be performed in Canada, or his body will be brought to India. It is not cleared yet, but his parents and his son last want to see the face. So that's all we have in this edition. Thanks for watching. Stay tuned for more updated news.